will be buying those cards by the truckloads. At least you know you're contributing to the Blind Association.
Exactly.
Which is, a good cause as well.
Yeah. And right now, talking about vascular diseases, we'd like to welcome
Dr. Kumaraguru Vicky Pillay, who's the vascular consultant. Diseases for a surgeon from HKL. So, Doctor, I actually had a chat with you last week about this. And one of the main contributors is actually smoking.
True, well said.
And it's often, reminded to people. So, can you just, share with us the overview of, what happens?
I think one of the reasons that we actually get influx of patients nowadays, basically in the younger age group, is because smoking is one of the biggest criteria. Lifestyle. I think modification of lifestyle is very important, and I think the attitude what we have towards smoking should be different. We should regard it as, if you smoke, it's going to kill you one day. Yeah. It's a very important thing that we should know.
Right. So we're talking about vascular diseases. What are there like more? Is there like more than one type of vascular disease?
Vascular diseases it's a realm by itself in surgery or in medicine itself, and we have three main groups, that is under the degenerative group, traumatic group, and also infective. Now, degenerative are in persons or people who are elderly, who go more than 60 years old, whereby the blood vessel undergoes changes, and due to these changes, diseases prevail. Well, in the traumatic regions, within the young age group, those who are going on to motorcycles, car accidents and everything, they can get shearing forces onto the vessel, subsequently giving them, injuries to the blood vessel. And subsequently, the last group will be infective. And infective, basically, you can have any type of infection, but mainly certain types of infections. And these infections actually give rise to a lot of problems towards the blood vessels.
Having, being a surgeon in this line for a very long time, and you've met lots of patients with different kind of conditions. Before we go to that, we have a question by one of our fellow viewers.
That's right.
Let's take a look at the clip.
We have a few questions. Let's take a look at the first question.
My name is Siti Jauda binti Maduan. I want to ask, what is the short-term treatment for varicose vein?
Varicose vein.
Varicose veins, what happens in varicose veins, it's an abnormally dilated vein that actually happens in the lower extremities. And the people or the patients who actually develop it, usually patients who are pregnant, people who are pregnant, they seem to have varicose veins. Why do they have it? Because of the intra-abdominal pressure that increases due to the child and the weight bearing of the child, and this engorges onto the vein, and the veins are prevailed onto the legs. Another type, basically, because why you get varicose veins are because, obesity, you can get varicose veins, lifestyle, some of them who have been working, standing up for a very long time, they get varicose vein. Depending on the type of varicose veins, onto the level of varicose vein, we have a certain classification. We will be able to give types of treatment for them. And this type of treatment basically can be simple, from sclerotherapy for small telangiectasis vein, or even to larger veins, we can even do HSVL, which is high surface vein ligation, and multiple step ablations, whereby we strip the vein off from there.
Oh, wow. Oh, all right. What can we see on the screen right now?
This is actually actually a CT scan of a patient who actually presented to us, and he had within himself an aortic aneurysm that actually was leaking. And the leak was actually seen from this particular clip, and you can see that the contrast, the white part there is contrast coming out from the blood vessel, and that shows that the blood is not confined within the vessel, it is out of the vessel. And we had to do emergency surgery for him, and he actually survived because he came in at the nick of time.
Okay, we have a caller online. Khairi, hello, morning.
Khairi from Perak, hello.
Good morning, Khairi.
Do you have a question for the doctor?
Vascular disease, I would like to ask the doctor to take into it. So, when we are talking about the vascular disease, what is the sort of the exercises that someone should embark on so that they would be able to address the vascular disease listed upon them? So what is the sort of the exercises, or if someone is engaged in sport activities, what is the sort of sport that they should resort to or embark on so as to ensure that they are not being inflicted by the diseases. So, and Doctor could clarify it further to me. Thank you very much.
All right,
Thank you,
thanks,
Kyrie.
Kyrie.
Thank you very much.
Okay.
Sportsman.
Yes, so sporting activities.
Okay, I think sportsmen are good, disciplined people. Why? Because they have a very healthy lifestyle. But you must understand, vascular disease itself is an ongoing disease with age. It's age-related. So when you have age-related diseases, it's bound to happen. But as Mr. Kyrie says, probably you can prolong it to a stage whereby it doesn't become a detrimental thing for them. Now, the most important thing is lifestyle modification. And the exercises that you can do, well, you can do walking exercises. And by walking, you can actually reduce the amount of pain onto your legs. You can increase circulation. You can increase the claudication distance. Claudication, what I mean is, if you happen to walk about 100 meters, after walking 100 meters, you get pains in the calf and you have to rest for a while, then you can continue. But by doing claudication exercises, you can increase this period. So thus you can walk further.
So be consistent.
Yeah, be consistent. I think for exercises for sportsmen, they are already good. They have a good pulse rate, they have a good heart. Usually their blood results are also good because they have a healthy diet. I think above all, the diet is important, lifestyle is important, exercise is important.
So aside from smoking, what else should they avoid?
Okay.
Should they, I mean, of course, smoking and also start to be more
Yeah,
active lah.
We live in Malaysia. We have lots and lots of food.
Yes.
I think that's one of the gifted thing about Malaysia, being in Malaysia, because we have a lot of food. But I think we have to come to a stage in life where we have to choose what we eat because we are what we eat. And at the end of the day, you can go on eating all the char kway teow, all the chendol you can start taking, but you will have to pay a price for it because you don't keep a control above it. If at all you know that you have a kind of disease, you have, for instance, you have diabetes or you have hypertension, but your food that you are consuming is high in sugar, is high in salt, I think you're not doing yourself any justice by doing that. Probably you can take it, but you can take it once a week or, you know, at a prolonged period or any other days. So I think the intake is important because when you take a lot of food, especially if you're diabetic and the sugars are high and your lipid levels are high, that means your fat is high, they tend to increase the viscosity of the blood and you will have, you know, sedimentation of these products onto the vessels. And these are the one that actually enhances the contribution towards vascular disease, in which it will give rise to obliteration of the vessels. So I think having a balanced lifestyle in what we do and what we consume is very important.
We're going to go to symptoms shortly.
Yeah, but right now we actually have a caller, another on the line. Good morning.
Hello.
Morning.
Hi.
Good morning.
Good morning.
Hello.
I want to speak to doctor.
Yes,
Go
ahead,
ahead.
ma'am.
Good morning.
Please ask
Good morning, everybody, doctor.
Good morning.
I just want to ask that for a lot of those exercise machine for like you always do the machine got one type is the shaking that one
Okay.
So now the modern one you stand there and they shake.
Oh.
Can we use for the vascular thing?
Disease.
Right.
So can you use it to avoid, to prevent? Thank
Okay,
you so much,
thank you.
ma'am.
Yeah. I think
Mrs.
I know
Tan.
what she means. The shake one.
Yeah.
I think is it the body tone?
Exercise
Yeah.
gadgets.
Yeah,
You know, how
yeah.
far does it help in
I
preventing?
think when we buy a gadget, we must find out what is the goal that we are trying to reach by using the gadget.
Okay.
Now, by shaking alone, I don't think so.
Does it
will be-
increase your heart rate?
Exactly.
That-
So we must find out what does it say in the
Yeah.
pamphlet regarding the exercise and what is it actually meant for. Because if you have for enhancing blood flow and everything, I don't think so certain machines will be able to contribute. So the exercise machines that we use has to be in line with what we want to do.
All right, let's talk about the symptoms. What are the things that we should look out for, you know, to know that, you know, this leads to vascular diseases?
Yes. Okay, one of the signs and symptoms that we have to know, like if we take for abdominal aneurysms or ballooning of the blood vessels in an elderly age group, sometimes probably if we are on a thinner ground and we are a bit more slightly on the smaller build,
Size?
we'll be able to feel some pulsations over a vessel. We might even feel a swelling over the abdomen. Mainly it happens in the abdomen about 75% of the time. So if we feel there is a pulsatile mass, then we will be able to go and see our doctor, and he will make a thorough checkup for you, and then he will be able to refer to us regarding what needs to be done.
So that's for the smaller size.
Smaller size.
Before we go further, Talib is on the line. He's
Yeah.
eager to ask you a
Talib
question,
from
Doctor.
JB.
Good morning.
Good morning.
Hi,
Hello,
Mr.
Talib.
Talib.
I'm Khan from Johor Bahru.
Mr.
Would I like to request you regarding for the some joint pains at our leg, my leg. This one, how to be recovered?
Joint pain on your leg.
Yes.
May I ask if you have any other medical history before this?
I did not think to medical, but suddenly this one joint pain come to my lower limb.
Okay. All right.
All right. Thank you
Thanks,
so
Mr.
much,
Talib.
Mr. Talib.
Right. Is there a direct correlation between
Joint
heart,
pains
vascular diseases to joint pains?
Well, there will be some type of diseases whereby you can have an immune response coming up from certain types of infection, and this can give rise to joint pains too.
I see.
So that is why when we look at a patient, we have to look at him in a very holistic approach, and we have to find out, as what Zaleha actually asked, the past medical history, past surgical history, any existing medical diseases of all this will be able to contribute in such a manner, but we have to find what is actually affecting the patient the most, and through that we'll be able to come up with a good working diagnosis. I think in Mr. Talib's case, probably he could be having some diseases which could be mainly an arthritic kind of disease, and we have to rule it out from any vascular diseases. Then only we'll be able to put a line of management for him.
Right. That's another question that's being posed by one of the viewers. So let's take a look at this video. Let's take a look at the question.
Adi bin Yusof. I want to ask doctor about vascular disease. What is the main difference between arteries and veins?
Down to basics,
Thanks,
arteries
yes.
and veins. And
I mean,
aortas?
Yeah, it's good.
It's a very good question. What we should know is arteries are thick. They have 3 layers. They'll have the intimal layer, medial layer, and advential layers, and they're muscular. And they actually take the blood from the heart to all the parts of the body.
Right.
Whereas veins, they return the blood back into the heart. And the veins are actually thin. They are more distendable, and majority of the time that we develop any of these diseases, what we have vascular diseases, are in arteries. They are more so in arteries than in veins. Like one of the veins that we always develop any problems are the long saphenous vein, whereby you have varicosities of the lower limb. But at times you can even have varicosities in other parts of the body due to other reasons, but they are more rare. But the diseases that actually prevail the most is actually in the arteries.
Now, back to the symptoms. For us on the smaller side, we can actually find it and detect it ourselves. Is it an ongoing pain, or does it go on and off?
It can be. Depending on the severity, depending on how large the swelling is, we'll be able to know whether the pain is going to be constant or colicky in nature. So that is why whenever you feel that something is not right, you see the patient is always right, most of the time. Because he's the one who's feeling it.
Yeah.
So I don't think so we'll be able to dismiss something from him just like that. So I think when a patient actually comes in with a symptom, we will actually have to probe into it.
But what about those on the larger side?
Yeah,
Yes.
from us on the larger side.
Oh, come on.
I think the patients on the larger side, yes. Majority of the times then we have patients who actually develop leaking aneurysms or ruptured aneurysms. They're on the larger side. Sad to say, because they're so large, they're unable to feel it. That is why constant medical checkups, constant medical treatment, and you have to take your medication on time. All this is important. So you will have to have a period whereby you see your doctor or your GP regularly, so that he will be able to find other ways to actually check on that. You see?
Right. I think we do have another question that's been posed. Do we have another question that's been posed out there?
All right, so it's okay. All right,
okay, we don't.
Doctor, as a
All right.
conclusion, what are the preventive steps that we can take?
That's right. Yeah, advice too, especially to the viewers out there, with all the nasi lemak and teh tarik available.
And the smoke.
Yeah.
Jamil just said the best concoction of what we don't want.
Yeah, I think nasi lemak teh tarik, they finish it off with cigarette habis.
Wow.
Okay.
I think the endocrinologists who are listening to this show will be very excited. In fact, that is one of the things that we have to change. This combination of nasi lemak and teh tarik, it's a deadly combination. Yeah. And I think at the end of the day, preventive measures are definitely better than going for cure. You see, because if you're going to go on cure, we have to do so many things. Yeah. So prevention is better than cure, right? So how do we prevent? Number one, we have to have a very healthy lifestyle. And above all, in Kuala Lumpur, it's a very stressful lifestyle. Yeah. We must try to reduce our stress levels, exercise regularly, and we must quit bad habits, So bad habits, example, smoking, excessive drinking. All these things will definitely help us in having pristine vessels, and definitely we'll stop ourselves from having any undue reasons for anything else.
Thank you so much.
Use less of your car, start walking.
Yeah, moderation is the key. Thank you so much, Doctor, for all the advice. And we hope that changes a lot of lifestyles today. Our producer has just, voiced out her fear of, having too much. But, don't forget, we have a lot of great healthy activities lined up for the month of October and November.
And you have 2 events to go to. One is the Children's Arts Festival, which is happening in Yusti Malaya, 1st to 6th of November. And on the 4th of November, which is the Charity Bazaar from the Lung Foundation of Malaysia.
And don't forget to register for your football team on the website by 31st of October. We hope you're all geared up to start your Monday. You start your week with positivity and full of love. On behalf of our producer, Miss Artini, and all the crew for Hello to this morning, we wish you a very good week ahead.
Take care, everyone.
You feel so helpless, you can't see which way to go.